What is the prostate? The prostate is a small gland found only in men. It sits just below the bladder and surrounds the upper part of the urethra, the tube that carries urine and sperm out of the body. Although it is only about the size of a walnut, the prostate plays a vital role in the male reproductive system. As men age, the prostate tends to change in size. In young men, it is relatively small, but it begins to slowly enlarge from the age of 40 onwards. This enlargement is often a natural process, but it can also signal a more serious health problem such as benign prostatic hyperplasia, BPH, or even prostate cancer. Primary functions of the prostate. The primary function of the prostate is to produce a fluid that is part of semen. This fluid contains various important substances that provide nutrition and protection to sperm during ejaculation. The fluid from the prostate helps sperm move more efficiently and survive longer in the female reproductive tract. Some other important functions of the prostate include seminal fluid production. About 20–30% of semen comes from the prostate. This fluid contains enzymes, zinc, and citric acid, protecting sperm DNA. The enzyme content in prostate fluid helps maintain sperm quality to stay healthy and fertile, helping ejaculation. The prostate works together with the muscles in the pelvic floor to push semen out during orgasm. Prostate changes with age. As we age, the prostate usually undergoes structural and functional changes. This can cause various disorders, ranging from mild disorders such as frequent urination at night to serious disorders such as prostate cancer. Therefore, it is important for every man, especially those who have entered the age of 40 and over, to understand how the prostate works and its health. Common prostate problems. Prostate health can be affected by a variety of medical conditions. Some are benign and can be treated with medication or lifestyle changes, while others are more serious and require intensive treatment. In this section, we will discuss 3 of the main problems that commonly affect the prostate: benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. Benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia. Benign prostatic hyperplasia, BPH, is a condition in which the prostate enlarges with age. Although not cancerous, this enlargement can press on the urethra and interfere with the flow of urine. BPH is very common in older men and is estimated to affect more than 50% of men over the age of 60. Symptoms of BPH include difficulty starting urination, weak or interrupted urine stream, frequent urination especially at night, feeling like you have not finished urinating. Causes and risk factors for BPH. Doing a major factor. Hormonal changes, especially increased dihydrotestosterone, DHT, family history of BPH, obesity and inactivity. BPH can be treated with lifestyle changes, medications such as alpha blockers and 5-alpha reductase inhibitors, or medical procedures such as minimally invasive therapy or surgery. Prostatitis, inflammation of the prostate. Prostatitis is inflammation or infection of the prostate. This condition can affect men of all ages, but is most common in men aged 30–50 years. Prostatitis can be acute, sudden and severe, or chronic, long-lasting and recurring. Types of prostatitis. An acute bacterial prostatitis, usually caused by a bacterial infection and appears suddenly. 2. Chronic bacterial prostatitis, a bacterial infection that lasts a long time and is difficult to cure. 3. Non-bacterial chronic prostatitis, most common, but the exact cause is unknown. 3. Prostatodynia symptoms. Resemble prostatitis, but there is no obvious inflammation or infection. Symptoms of prostatitis: pain in the lower abdomen, groin, or lower back, burning sensation when urinating, fever in acute cases, disruption of sexual function. Prostate cancer, a serious threat in old age. Prostate cancer is one of the most common types of cancer in men. In many countries, including Indonesia and the United States, prostate cancer ranks high in the number of cases and deaths from male cancer. Risk factors for prostate cancer: age over 50 years, family history of prostate cancer, race, for example, black men have a higher risk, high-fat, low-fiber diet, exposure to certain chemicals, symptoms of prostate cancer, difficulty urinating, blood in the urine or semen, pelvic or lower back pain, unexplained weight loss, Symptoms, risk factors, and early detection of prostate problems. Common symptoms of prostate disorders. The symptoms that appear depend greatly on the type of prostate disorder experienced. However, some general signs to watch out for include difficulty urinating, can be difficulty starting, weak stream, or feeling incomplete, frequent urination at night, nocturia. This is one of the typical signs of an enlarged prostate, BPH. Pain or burning when urinating can indicate infection or inflammation. Discomfort in the perineal area, between the anus and scrotum, blood in the urine or semen, is a serious warning sign that should be checked immediately. Erectile dysfunction or painful ejaculation. It is important to remember that many of these symptoms can also be caused by other conditions, such as urinary tract infections or kidney stones. Therefore, medical consultation is still needed for an accurate diagnosis. Risk factors for prostate disorders. Some men have a higher risk of developing prostate problems, either due to genetic factors, lifestyle, or other medical conditions. Here are the factors that play a role. The risk of prostate disorders, especially BPH and prostate cancer, increases dramatically after age 50. Family history. Men who have a father or brother with a history of prostate cancer have a twofold increased risk. Race or ethnicity. Black men have a higher risk of developing aggressive prostate cancer. Unhealthy lifestyle, including a diet high in saturated fat, low in fiber, lack of physical activity, and smoking. Obesity, excess body fat can affect hormone levels and increase the risk of BPH and prostate cancer. Exposure to chemicals such as pesticides or certain heavy metals. The importance of early detection and regular checkups. Early detection is key to effectively treating prostate problems. The earlier prostate disorders are caught, the greater the chance of successfully treating them and preventing long-term complications. Some common early detection methods used: Weiswein prostate-specific antigen test, a blood test that measures PSA levels. High levels can be a sign of prostate enlargement, inflammation, or cancer. Digital rectal exam, DRE. The doctor will feel the prostate through the rectum to check the size, texture, and abnormalities. Transrectal ultrasound, TRUS, is used if suspicious results are found to see a clearer picture of the prostate. Prostate biopsy. If cancer is suspected, a sample of prostate tissue is taken for further examination. When should you start prostate examination? Men aged 50 years and over, routine annual examination. Men with a family history, start screening from the age of 40-45 years. Early detection not only saves lives but also allows for milder and more effective treatment. How to treat and prevent prostate problems. Maintaining prostate health is not only important for older men, but also for young men who want to live healthy and active lives in old age. Treatment for prostate disorders depends on the type and severity of the condition. However, prevention is always better than cure. Medical treatment for prostate problems. Treatment for BPH, benign prostatic hyperplasia. Medications, such as alpha blockers, tamsulosin, alfuzosin, which help relax the prostate and urethral muscles, and 5-alpha reductase inhibitors, finasteride, dutasteride, which shrink the size of the prostate. Minimally invasive procedures, such as heat therapy, TUMT, microwave therapy, or laser ablation. Surgery, such as TURP, transurethral resection of the prostate, for severe cases of BPH. 2. Treatment for prostatitis, antibiotics, especially if the cause is a bacterial infection. Non-steroidal anti-inflammatory drugs, NSAIDs, to relieve pain and inflammation. Physical therapy, such as prostate massage or pelvic floor muscle exercises. Lifestyle changes, such as avoiding alcohol, spicy foods, and sitting too long. 3. Prostate cancer treatment, active surveillance. If the cancer is still early stage and growing very slowly. Prostate surgery, prostatectomy, to remove the entire prostate. Radiation therapy, both external and internal. Brachytherapy. Hormone therapy, androgen deprivation therapy, to inhibit hormones that trigger cancer growth. Chemotherapy, in cancer that is spread or is unresponsive to hormone therapy. 2. Prevention, healthy lifestyle for the prostate. Keeping the prostate healthy starts with daily habits. Here are some preventive steps that can be taken. 3. Eat healthy foods. High in fiber, low in saturated fat, and rich in antioxidants. Avoid processed foods, excessive red meat, and trans fats. 2. Regular physical activity. Regular exercise for at least 30 minutes a day, 5 times a week. Exercises such as walking, swimming, or yoga are very helpful. 3. Maintain ideal body weight. Obesity is closely related to the risk of prostate cancer and worsening BPH. 4. Pay attention to urination patterns. Do not hold urine for too long. If you often wake up at night to urinate, consult a doctor immediately. 5. Avoid alcohol and cigarettes. Smoking can worsen prostate symptoms and increase the risk of cancer. Excessive alcohol also worsens prostate function. On routine prostate examinations. Don't wait until symptoms appear. Early examination helps early detection and prevention. 3. Stress management and mental health. Chronic stress can affect the immune system and worsen conditions such as prostatitis. Breathing exercises, meditation, and adequate sleep can help improve prostate conditions indirectly. Recommended foods for prostate health. Diet is one of the most important factors in maintaining prostate health. Proper nutrition can help prevent prostate enlargement, reduce inflammation, and even lower the risk of prostate cancer. Important nutrients for the prostate. Several nutrients play a key role in keeping the prostate healthy. Lycopene, a powerful antioxidant found in tomatoes, known to reduce the risk of prostate cancer. Zinc, essential for immune function and male hormone balance. The prostate contains high levels of zinc, vitamin E, and selenium. This combination has been shown to protect prostate cells from oxidative damage. Omega-3 fatty acids help reduce inflammation and improve cell function. Vitamin D, low levels of vitamin D, are associated with an increased risk of prostate cancer. Fiber and phytonutrients from green vegetables, fruits, and whole grains help improve hormone metabolism and digestion. Recommended foods. Here's a list of foods that are highly recommended for prostate health. Rich tomatoes and tomato products. Contains high amounts of lycopene. Cooked tomatoes, sauces, soups actually release more lycopene than raw tomatoes. 2. Fatty fish, salmon, sardines, mackerel. Good source of omega-3. Reduces inflammation in prostate tissue. Nuts and seeds. Almonds, walnuts, pumpkin seeds, and sunflower seeds are rich in zinc and vitamin E. Helps balance hormone levels. 4. Cruciferous vegetables. Broccoli, cauliflower, kale, and cabbage contain sulforaphane, a compound that protects against prostate cancer, so high in fiber and low in calories. 5. Berries. Strawberries, blueberries, and raspberries contain antioxidants that protect cells from oxidative stress. 6. Soy products and tofu. Contains isoflavones that can help regulate testosterone and estrogen hormones. 7. Green tea. Contains catechin and EGCG, which help fight the growth of prostate cancer cells. Also anti-inflammatory and increases metabolism. 8. Extra virgin olive oil. Healthy fats that help reduce systemic inflammation. Good as a substitute for margarine or regular cooking oil. Example of a daily menu for prostate health. Morning. Oatmeal with sliced blueberries and sprinkled with pumpkin seeds. Warm green tea. Lunch. Brown rice. Stir-fried broccoli and cauliflower with tofu. Fresh tomato soup. Afternoon snack. Almonds and apple slices. Evening. Grilled salmon with green vegetable salad. Quinoa or boiled potatoes. Unsweetened watermelon juice. Reduce the use of excessive salt and sugar. Avoid foods that are fried in oil repeatedly. Foods to avoid to reduce the risk of prostate disorders. Some foods high in saturated and trans fats. Examples: fatty red meat, beef, goat, lamb, sausages, hot dogs, and processed meats. Fast food. Fried foods and margarine. Impact on the prostate. Saturated and trans fats can increase levels of androgen hormones, such as testosterone, which are associated with prostate tissue growth. These fats also trigger chronic inflammation and oxidative stress in the body, increasing the risk of prostate cancer. 2. Processed products and foods high in sugar. Examples: white bread, cakes, biscuits, and sweet cereals. Soft drinks and packaged juices. Sweets and sweet snacks. Impact on the prostate. Excess sugar accelerates the inflammatory process and causes insulin resistance, a condition that also worsens prostatitis symptoms and lowers immunity. Processed products tend to be low in fiber and important nutrients for the prostate. Your high salt, sodium foods. Examples: Canned food, packaged chips, instant sauces, and artificial flavorings. Impact on the prostate. Excessive salt can affect blood pressure and burden the kidneys, which indirectly interferes with urinary tract function. High-salt foods also worsen symptoms of prostate enlargement, such as frequent urination at night. First, alcohol. Impact on the prostate. Excessive alcohol can cause dehydration and irritation of the urinary tract, triggers inflammation and inhibits the immune system. Regular consumption in high amounts can worsen prostatitis and increase the risk of prostate cancer. 5. Milk and high-fat dairy products. Examples: full cream milk, cheese, cream, and butter. Impact on the prostate. Several studies have linked high consumption of full-fat dairy products to an increased risk of prostate cancer, although this relationship is still being studied further. Milk can also trigger inflammatory reactions in some individuals. 6. Excessive caffeine. Example: strong coffee, excessive energy drinks, and black tea. Impact on the prostate. Caffeine has a diuretic effect that can worsen the frequency of urination, especially in people with BPH. Disturbed sleep at night due to frequent trips to the bathroom, worsening quality of life. 7. Spicy and strongly seasoned foods. Example: excessive chili, hot sauce, and strong spices such as black pepper. Impact on the prostate. Spicy foods can irritate the bladder and worsen pain or burning when urinating, especially in people with prostatitis. Relationship between modern lifestyle and the risk of prostate disorders. In the modern era, many daily habits indirectly increase the risk of prostate disorders. Fast food diets, sedentary lifestyles, minimal physical activity, high stress, and exposure to chemicals can contribute to the development of prostate disease, either in the form of enlargement, inflammation, or cancer. Sedentary lifestyle and its impact on the prostate. What is a sedentary lifestyle? A sedentary lifestyle is the habit of sitting or being physically inactive for a long time, such as working in front of a computer all day without enough physical activity. Its impact on the prostate disrupts blood circulation to the pelvic organs, including the prostate, triggers pressure buildup in the perineum, the area between the anus and genitals, increasing the risk of prostatitis, reduces insulin sensitivity and worsens hormone metabolism, contributes to obesity, which is directly related to prostate enlargement and prostate cancer. Solution: take a break and stand every 30-60 minutes while working. Do some light stretching or a short walk for 5-10 minutes. Add regular exercise to at least 150 minutes per week. 2. Poor sleep patterns and prostate health. Lack of sleep or poor quality sleep can affect hormone balance and worsen prostate conditions, especially in men with symptoms of nighttime urination. Nocturia. Impact: lowers melatonin levels, a hormone that also has anti-cancer effects. Increases cortisol levels, stress hormone, which can trigger inflammation and worsen prostatitis. Solution: sleep 7-9 hours per night. Avoid gadget screens 1 hour before bed. Use dim lighting and cool room temperature. 3. Chronic stress and emotional tension. Long-term stress negatively affects the immune system and hormone balance. Several studies have also shown that stress plays a role in worsening chronic prostatitis symptoms and accelerating the growth of abnormal prostate cells. Solution: apply relaxation techniques, meditation, deep breathing, or yoga. Make time for hobbies or recreational activities. Seek professional help if you are experiencing severe anxiety or depression. 4. Taking the wrong supplements. Many men take supplements without professional guidance, which can be dangerous if not appropriate. Example: unnecessary testosterone. Supplements can accelerate the growth of abnormal prostate tissue. Taking too high a dose of certain vitamins or minerals can be stressful to the body. Solution: consult your doctor about all supplements, especially if you already have symptoms of prostate problems. Focus on whole natural foods rather than relying on supplements. Relationship between modern lifestyle and the risk of prostate disorders. In the modern era, many daily habits indirectly increase the risk of prostate disorders. Fast food diets, sedentary lifestyles, minimal physical activity, high stress, and exposure to chemicals can contribute to the development of prostate disease, either in the form of enlargement, inflammation, or cancer. In sedentary lifestyle and its impact on the prostate. What is a sedentary lifestyle? A sedentary lifestyle is the habit of sitting or being physically inactive for a long time, such as working in front of a computer all day without enough physical activity. Its impact on the prostate disrupts blood circulation to the pelvic organs, including the prostate, triggers pressure buildup in the perineum, the area between the anus and genitals, increasing the risk of prostatitis, reduces insulin sensitivity and worsens hormone metabolism, contributes to obesity, which is directly related to prostate enlargement and prostate cancer. Solution: take a break and stand every 30-60 minutes while working. Do some light stretching or a short walk for 5-10 minutes. Add regular exercise to at least 150 minutes per week. Poor sleep patterns and prostate health. Lack of sleep or poor quality sleep can affect hormone balance and worsen prostate conditions, especially in men with symptoms of nighttime urination, nocturia. Impact: lowers melatonin levels, a hormone that also has anti-cancer effects. Increases cortisol levels, stress hormone, which can trigger inflammation and worsen prostatitis. Solution: sleep 7 to 9 hours per night. Avoid gadget screens 1 hour before bed. Use dim lighting and cool room temperature. 3. Chronic stress and emotional tension. Long-term stress negatively affects the immune system and hormone balance. Several studies have also shown that stress plays a role in worsening chronic prostatitis symptoms and accelerating the growth of abnormal prostate cells. Solution: apply relaxation techniques, meditation, deep breathing, or yoga. Make time for hobbies or recreational activities. Seek professional help if you are experiencing severe anxiety or depression. 4. Taking the wrong supplements. Many men take supplements without professional guidance, which can be dangerous if not appropriate. Example: unnecessary testosterone. Supplements can accelerate the growth of abnormal prostate tissue. Taking too high a dose of certain vitamins or minerals can be stressful to the body. Solution: consult your doctor about all supplements, especially if you already have symptoms of prostate problems. Focus on whole, natural foods rather than relying on supplements. Practical tips for maintaining prostate health from young to old age. Maintaining prostate health does not have to wait until symptoms appear. In fact, prevention from a young age to old age can significantly reduce the risk of prostate disorders. In this section, you will find practical guidelines that can be applied at every stage of a man's life, from his 20s to old age. 1. Age 20-30 years, building healthy habits early. Main focus: building a foundation for a healthy lifestyle and long-term prevention. Tips: start exercising regularly at least 3 times a week. Avoid smoking and excessive alcohol consumption. Reduce fast food and high-sugar foods. Consume fruits and vegetables every day. Get enough sleep and manage stress well. Why is it important? Although prostate disorders are rare at this age, bad habits that start at a young age can have serious impacts in old age. 2. Age 30-45 years, maintaining hormonal balance and productivity. Key focus: maintaining metabolic and hormonal health while balancing the demands of work and family. Tips: get an annual health check, including cholesterol and blood sugar levels. Monitor your weight and waistline. Increase your intake of foods high in zinc, omega-3s, and antioxidants. Limit sitting time. Stand or walk every hour. Note: the balance of hormones, like testosterone, is essential for sexual function and prostate health. 3. Age 45-60. Be aware of early symptoms of prostate disorders. Key focus: early detection and stress management. Tips: get your PSA levels checked regularly, especially if there is a family history. Be aware of symptoms such as frequent urination at night, weak urine flow, or pain. Maintain nutrient intake from tomatoes, broccoli, green tea, and fish. Cut back on red meat, full-fat dairy products, and high-caffeine beverages. Note: at this age, the risk of prostate enlargement naturally increases. Through age over 60, intensive care and monitoring. Main focus: routine monitoring, maintaining quality of life. Tips: perform DRE and PSA examinations as recommended by your doctor. Maintain body mobility and prevent obesity with light exercise such as morning walks, swimming, or yoga. Maintain hydration, but limit drinking before bedtime to prevent sleep disturbances. Discuss any new symptoms with your doctor, including changes in urination patterns.